Wake County Human Services is dedicated to providing social, public health, behavioral health, job training, and child support, housing, and transportation services to people in Wake County. We serve more than 140,000 people each year. The agency's goal is to promote and support health and well-being and to build human capital for everyone in Wake County. If you live, work, or receive health care in Wake County, I'll bet there's some things you'd like to know about our Human Services Department. Did you know that in 1995, Wake County was the only county that took advantage of a new law that allowed for the provision of integrated human services in North Carolina? That means that our agency functions as 6 departments in one. Ramon Rojano is the director of Wake County Human Services, which employs more than 1,800 employees, has a budget of about $951 million, and provides services from 25 or more locations as well as outreach across the county. Director Rojano feels that our job is to help people help themselves.
Thank you, Regina. Our vision in Human Services Department is that all Wake County residents will have full and easy access to high-quality public health, social services, and mental health in the county, and also opportunities to develop themselves and improve the quality of their lives. Did you know that services that we provide are available for everybody in the county? And we believe that at some point, everybody in Wake County will benefit from our services in one way or another. Particularly now with the economic uncertainty, our economic self-sufficiency programs are helping people meet their basic needs for themselves and their families, while simultaneously working on retooling their own skills and being able to find better jobs. These employment activities happen primarily at our JobLink centers. We have some of them in Wake County, and this is where we help people with computers that are linked into employment opportunities, and also staff is available to help with resume writing, job finding, polishing your skills to help you access a better employment.
My name is Grace Willard, and I'm a Wake County citizen, and I've had 25 years of pharmaceutical industry experience. Now, right now, I am in a workforce reduction status, and I am seeking employment. As you know, when you're laid off and you have so many years of working, you don't know what to do. That really throws you out of your orbit. So 3 weeks after I got laid off, I started seeking opportunities with Human Services with JobLink, because I had heard they were providing tools to enhance my job skills. Before I got laid off, I had no reason to use Human Services because I was in my comfort zone and thinking it would never happen to me. Well, yes, it will happen to you. Life comes at you fast, just like the commercial says. So JobLink was there. They have really helped me a whole lot. And with JobLink's assistance in financial help and also in direction, I've been able to complete these courses and really find myself in a new world, in a new working world. I also got a satellite station in Zebulon that has a human resource development, which helps my deficiency in the computer world. Yes, my birth date is the demerit for me right now, and so I am in that generation that needs computer help, and we have the Excel and PowerPoint, and we also have Career Profile, which is the resume in the future. You have a website that you develop. Instead of sending your resume, you give your website address so they can look at your courses and your education and anything they need to know about you. So right now I am took courses at the Capstone Center, which I have had analytical lab courses and the biomanufacturing courses, which is the future in jobs. Since everything is so stale in the economy now, I'm looking for the future outlook, and the Capstone Center has provided me this. in this course of construction, of rebuilding and reinventing myself, these people have really, really helped me. I don't know what I would do without them. Between God and family and JobLink, all things are possible.
And if we go to the other side of the department, we'll find that we have very good public health programs and health clinics where we help primarily like pregnant women or children that need to access health care. We provide them not only with the services but also with education so they live healthy lives.
The services you may not see until you need them are our disaster preparedness services, where we work with Wake County to assure that if there is a weather or disease-related disaster, we can get help to people who need it, especially those who are most vulnerable. We also monitor, diagnose, and investigate disease outbreaks and other community health problems and hazards, and enforce laws and regulations that protect the public. Wake County Human Services offers outreach and education in many community settings for the prevention and detection of diabetes, heart disease, cancer, and sexually transmitted diseases, including HIV and AIDS. And we work with many community partners who are serving the same populations we are and who are working to build healthy neighborhoods and environments. These partners are addressing needs like more and safer walking trails and better health policies, such as limiting exposure to secondhand smoke. The Health Clinics Division provides preventive clinical services to women who are pregnant or who have just had a baby, children ages birth to 12, and women seeking contraception and early cancer detection. Dental screenings and treatment to children and pregnant women, and diagnosis and treatment of sexually transmitted illnesses such as HIV, AIDS, and tuberculosis. Our clinics offer services for women such as WIC, which is Women, Infant, and Children's Services, and services for young children.
I'm Adriana Araújo, and I am a Wake County Human Services WIC client. I first came to WIC in 2004 when I attended a breastfeeding class. I had no experience with breastfeeding because it was my first child, and I came back to the WIC program in 2008 for a breastfeeding class again, and I still counting with the support of the WIC program through the breastfeeding counselor, which she has been great to me.
My name is Stephanie Hoosier, and I am a Wake County citizen. I came to Wake County's prenatal clinic because I was pregnant and I didn't have insurance. I had Medicaid, and Wake County Clinic is close to where I reside. When I started to come to the prenatal clinic, I was currently enrolled at ECPI for medical assistant, and I felt comfortable here with the nurses and providers, so I also started doing my internship at the clinic. I felt so comfortable also when I was doing my internship, and when it was over, I asked the nurse supervisor if there was any positions open to keep me posted, because I saw the work experience, how they all got along and worked together.
I would recommend my friends to seek help with the WIC program for breastfeeding because I have found great support and guidance from the WIC program with the breastfeeding counselor, and it has been a great experience to me.
My experience at the Wake County Prenatal Clinic was very wonderful. The nurses and providers made me feel very comfortable.
Another testament to our health clinics is that Wake County has achieved the highest immunization rate of any metropolitan county in North Carolina. Human Services offers immunization services for children and adults. In addition to routine immunizations, the county also offers foreign travel vaccines and counseling for people traveling abroad. And we provide vaccines required for people seeking citizenship status. Wake County residents can call 919-250-3900 to make an immunization appointment. So you can see, public health touches each and every one of us. Now, let's talk about some of our services for children, youth, and their families. Wake County Human Services staff works with children, youth, adults, and families in communities to ensure and to achieve safety, well-being, and self-sufficiency. Human capital development is the foundation of this work across the lifespan at the individual, family, community, and system levels. We work in partnership with the community to maximize resources for children and families in Wake County. Ramon previously mentioned our behavioral health services. What does that include? It includes the local management entity, or LME, oversees the provision of publicly funded community-based mental health, substance abuse, and developmental disability services. The goal is to ensure that quality services are available and accessible in the community to people in Wake County. The LME performs statutory functions required by the state of North Carolina. They ensure that there is care coordination and that a network of services is available in the community. Behavioral Health Division provides crisis intervention, bridging services, inpatient substance abuse treatment, and acute medical detox. They also provide outpatient adult and child mental health and psychiatric consultation services. These are important services that help us maintain a good quality of life for all people living in Wake County. That is not all we offer. Bob Sorrells is Deputy Director for Wake County Human Services. Bob, you're responsible for the operations side of Human Services, but what would you like to tell us about an important strategy of service delivery that you can get regardless of where you are?
Thank you, Regina. In Wake County Human Services, we embrace a service characteristic we call human capital development. Human capital development is a concept that's become known nationally as a best practice model in the delivery of human services. A specific strategy that we employ here in Wake County is called the Middle Class Express Initiative, and I want to tell you a little more about that. The Middle Class Express is an innovative approach that assists users of social services programs in moving out of poverty into middle class. Using life coaching as a strategy, it helps participants develop life plans aiming at upper socioeconomic mobility. It requires at least 40 hours a week of sweat equity in the form of work, study, or training. Working progressively on 8 developmental tracks, it helps participants connect with opportunities to move forward. Over 100 clients have benefited with different degrees of participation and commitment.
The moment that I realized that this program was fit for me was when it told me to dream, to think past just tomorrow and the next day, but to look at that. It took me back to my childhood, those dreams that I had, the passions that I had before life took a hold of me and stopped me from dreaming. So I think that was the moment for me, that I knew it was for me. I see my life changing dramatically. My focus was so much just on my career, but not necessarily my family, what my family needed, what my spirituality needed, what my physical fitness needed, just different areas versus just one thing that only I could see. But once it just opened doors to me in other areas that I knew that I didn't realize that I needed to work on. What keeps me going when things get rough is that encouragement from my life coach. She just keeps me motivated. She guides me and let me know when I'm choosing possibly a wrong path, not necessarily wrong, but she just gives me other ideas.
The Middle Class Express is now being used as a statewide model by the North Carolina Association of County Commissioners. There are many other examples of how Wake County Human Services is building human capital. This is just one of the ways.
While we value partners in Wake County, our volunteers are equally important. Wake County Human Services has over 1,000 volunteers and interns. A great example of volunteerism is our Human Services and Environmental Services Board. The Human Services and Environmental Services Board is a policy and advocacy board charged with representing the broad interests of the community through statutorily defined representation. The board has chosen 5 priorities to focus on for the current year. These include prevention of child abuse and support of families, housing for vulnerable populations, obesity prevention and nutrition, access to physical and mental health services, and protecting Wake County's water resources. Wake County Human Services is in partnership with the community, and with our community, we will respond to the public health, behavioral health, and the economic and social needs of all our residents. How can you help? Be educated and aware of the services that are provided to the most needy and vulnerable of your community with your tax dollars. Help us with our prevention and community building initiatives by connecting us to others who have the same goals in mind. Volunteer with our programs and services. And let us hear from you about the services you value and that you feel make our community the best place to live, work, play, and learn. For more information on Wake County Human Services, please visit the wakegov.com/human services website or call the Office of Community Affairs at 919-250-4558.